Please welcome to the show, Dr. Contessa Metcalfe.
Hello. Hi.
Hi, thank you so much for joining us. And I want to say, as far as the clip that we just watched, I want to thank you for sharing your story, your family history, getting screening, and sparking that conversation because, we don't talk about these things enough. And by you sharing your story, you've empowered hundreds, if not thousands of people to get screened and talk about their own family history. So thank you for that. And keeping along the line. Oh.
No, I was going to say, and there was a little correction there because my husband's like, the BRCA test said nothing. There was nothing to worry about. Well, that's not true. I had what's called a BRCA mutation of undetermined significance. And so your BRCA genes, everyone has BRCA. We have BRCA, they're breast cancer genes that actually protect you from getting cancer. When there's a mutation, then that actually increases your risk of cancer. So I had a mutation of undetermined significance. And so that's what made me worried.
Okay, got it. Well, that's helpful to know. I mean, I know Breast Cancer Awareness Month was last month, but still we need to be talking about that all year round. And it actually sparks a conversation about prevention. And you have a motto, prevention is the key to healthy living. And so with the flu season coming, everybody is worried about their immunity and getting sick. So what are your thoughts on vaccines this, winter season and things that people can do to help boost their immune system?
Well, as a preventive medicine doctor, I just have to be honest. Vaccines save lives. I mean, the reason that our life expectancy actually is much longer than it used to be is 100% due to vaccines. So what used to happen was we would get an infectious disease, very much like COVID, like SARS-CoV-2, and we would die, right? Cholera, things like that. Rotavirus, all those things that in the flu, of course, the flu of 1918, that pandemic killed so many different people. But just to understand how long the flu vaccine has been around, 1936. So it's a very, very old vaccine. And for that reason, it's actually pretty safe. And there are different deviations of the flu vaccine. A lot of people are like, oh, when I get the flu shot, it makes me sick. Well, that's a killed virus. And so what happens is you actually don't get the live virus. When you get the flu mist, which is the one that goes into your nose, that is a live virus. And so some people we don't give it to people who are pregnant and people who are high risk for like immunosuppressed. But that is a different, that's a different risk. So no, when you get the shot, you actually probably were already on the cusp of getting sick, but you did not get the flu from the flu shot. So I'm absolutely 100%, especially in this world where what do we have? 3 million cases of the flu in 3 weeks? I mean, coronavirus, SARS-CoV-2 in 3 weeks, 3 million cases, 64,000 people in the hospital. I don't even know why you even want to risk the possibility of getting the flu and coronavirus at the same time.
Exactly. And so, and some of this, Dr. Contessa, is they have similar symptoms, right? Initially. And so a lot of people have been concerned, like, so do I need to get the flu shot and the coronavirus vaccine? So I'm also curious to know, what are your thoughts on Operation Warp Speed and the coronavirus vaccine?
That's really shocking to me. I mean, I actually didn't anticipate the coronavirus vaccine being available probably for another year or two. So the fact that it happened so quickly is really surprising to me. There are different types. There's the RNA and there's the DNA vaccine, and both have been found to be about 94 to 95% effective. However, just do understand that there is still, even though the vaccine got FDA approval, they're going to continue to do studies on people who have gotten the vaccine to still determine efficacy and safety. And so with each, they call them clinical phases of the, like clinical trials. This is what happens is people say, I volunteer to participate in this clinical trial for this new drug or vaccine. That's a small amount of people. And then with each progressive phase, if they determine it's safe, they continue to get bigger and bigger populations of people that get, served by this, this trial. And so at this point, it's been found to be relatively safe. It's been, generating an immune response in 95% of the people. And so that's actually a good sign. As far as whether or not, I'm always worried about when something comes out really quickly and like that, being in that first group of anything, I probably would not have volunteered to be in the study group. So that's just telling you how I feel about like new stuff. I got an old iPhone, I got an old everything, but I will tell you this, once the data has gotten better, I will be 100% in line to get that shot. I'm just telling you. But for the people who who are really having really poor outcomes, people who are really severely ill, people already, and people who are really high risk of, like, elderly people who are already high risk of, if they get SARS-CoV-2, they can die. I would say you have to really weigh the risk and the benefits. And that's what I'm saying. So for the people who are at the highest risk of complications, I really think that you shouldn't even listen to what the other people are saying about, oh, it's a new vaccine.
Right. There's lots of reservations.
It's like experimental. Like if you have like a really, like a end stage cancer, right? You're like, hey, whatever I can do to survive. If you're in a high risk population, then this is a totally different conversation. But if you're just a regular person who, doesn't have a lot of comorbidities, you probably won't be offered the vaccine immediately anyway. So just to tell you that they don't have enough to serve everyone.
Right. So definitely a conversation that you need to have with your healthcare provider, because it's going to be a different conversation, whether you're completely healthy and younger, or if you're older and you have, multiple conditions like diabetes, hypertension, and all those things. But I think, Dr. Contessa, as health professionals, we share the same thoughts on just having some reservations when anything is new, because we are here to do, we want you to get well and be safe, and we're just, being precautious. We don't want anything to, anything bad to happen. So that's good. We're just going to be.
I don't tell people to sign up for experiments. So that's at this point, it still feels that way for a lot of people, and I'm acknowledging that. But I will also say that the FDA, despite what people believe, there is no vested interest for them to, fudge the data, right? There is nothing in them there is no benefit. There's no kickback that happens to these people who are government employees to get, to approve something, to look at the data and say, oh, I'm going to, be biased in the favor of, the data. If the data says it is safe, they approve it. If it's not safe, they don't approve it. And that's kind of what it boils down to.
I think we all just want to be safe. We just don't want any more than the nearly 250,000 Americans to die. So the point is, we're trying our best. Yes.
Take it seriously.
Exactly. We're just trying our best to keep people alive, well, and healthy. And along those lines, people are going to be celebrating Thanksgiving.
Yeah, for sure.
So, this is usually the time of year where everybody comes to the house and, we're all talking and eating and just gathering together. But those behaviors can actually be counterintuitive to how to protect ourselves from the coronavirus. So what are some of your health tips for people who are watching so they can protect themselves?
Well, two things. The CDC is actually recommending people not gather outside of their immediate family. And so if you're already in a pod outside of your immediate family, meaning that you've been social distancing outside of, with another family, then maybe that family can be a family that comes and joins you. Or you're already in contact with another family that, they don't go anywhere and you don't go anywhere. And you guys have decided that we're going to, stay away from everyone until Thanksgiving and we're going to get together. But you see that those are very specific situations. But this whole idea of doing it like we did it and it feels like, it's going to sound weird, how we did it in 2019, those are days of old. Don't get together in big groups, because it's not really about, again, you and your friends. It's about if you were to contract the virus and then take it to someone who then doesn't have the, easy case that you had, then you're going to feel awful forever. And it's really not about, you don't want to live with guilt. You don't want to, be that person that passed on the virus and unfortunately led to grandma, grandpa, Auntie Alice, Auntie Contessa really getting really sick. You're going to feel terrible forever.
Yeah, don't bring the COVID home down to your family and your grandparents.
And if you can do something outside, if the weather permits and you can have an outdoor picnic type of situation, that's a little different, because again, what we've learned is when we talk about airborne, when you're in an enclosed space and you're talking a lot, and again, with Thanksgiving, we're going to be socializing, and you're at a table in an enclosed space, that's increasing the risk of you passing it on to other people, which is exactly what you do at a Thanksgiving table.
Exactly. And so guys, be very, very mindful of how you celebrate Thanksgiving. Again, try to, only celebrate with those in your immediate, and then virtually or outdoors. But Dr. Contessa, speaking of outdoors, we've been told to quarantine, stay home, don't put off all of the non-urgent visits. But now we've been in this for so long, people actually need to kind of get back out to their providers. So you and your husband, Dr. Scott Metcalfe, hey, Dr. Scott.
He's helping me tell you hey too.
So I'm just curious. So you actually have another practice.
Yeah, we just opened our own practice.
Wonderful. So are you seeing more patients coming out? Are they a little still leery about, wanting to come out to see the provider? What are you seeing?
It's actually mixed. I would say I first was working for a big medical facility. And so we had rules. For non-essential patients, we were seeing them all via telemedicine. And so now we've found that, we've been letting more and more patients in the door. And so some people are actually eager to kind of get you to see them. They don't feel like they're getting a full exam, are really getting their message across with telemedicine. But telemedicine has been a wonderful tool for providers to really reach the masses. With that being said, we have seen, and it all depends on the type of patient. So if we're talking about, especially patients with mental health disease or addiction, then a lot of times they have to get labs and things like that in order to continue on the medications that they're on. And so for some people, you do have to see them. You have to get vitals. You have to get information from them. So it all depends. But some people we have scared indefinitely, and they will never leave the house again. Until the vaccine is out there, they have just said, I will not go. Their kids are still at home with them. And one big thing that has happened, unfortunately, is, I don't know if you saw it, I think it was on 60 Minutes, there are a lot of kids who aren't even in school right now. They're just completely unaccounted for because their parents have locked them down and they don't even have access to the technology to keep them engaged in school. So we have created this kind of, now this hybrid of what America looks like. There are people who are going to stay in the house until a vaccine comes and saves the day. And there are other people who are kind of going back to life as though nothing ever happened. I think the right answer is somewhere in the middle.
We have to figure that out. It's our new normal. So we're trying to figure things out as we go. That's going to be a challenge. Again, there's the technology divide. Some people have access to technology, some don't. But we've been thrusted into it, especially with the quarantine order, stay home. But I will say, I think there is a good part of the telemedicine piece, because maybe people who wouldn't go out, at least maybe now they'll at least, FaceTime their doctor, through the computer, through the phone. So that's a good thing. But Dr. Contessa, I want to ask, because you are one of our favorite doctors on TV. Speaking of TV, Married to Medicine season 8. Word on the street is that it's going to premiere in January. Can you drop some gems? Can you give us a little insight, a little exclusive on what we can expect this upcoming season?
Well, I will tell you, it's going to be a lot of surprises. I mean, some of the people who have been, you've been curious about what happened to this person. I wonder how they're doing. Are they still in the circle? You'll be able to see some of them come back into our circle, which is actually really cool. Okay. People have been, because of just kind of what happened with the world of being turned upside down, I think a lot of people have let the veil down and they've allowed you into their homes, into their bedrooms, into their lives, and into what's really happening with them. And so I would say this season is probably the most vulnerable and emotionally taxing that you probably will have ever seen on television. And I'm really proud of what Married to Medicine was able to do this year. We tackled it all, from social justice to the pandemic to, drama to, relationships and sex, a little bit of everything. It's all in there. It's like everything.
Lean in.
Sex is important for you. Sex is important to health. We all know that. You know that. So we talked about it all. Ups and downs, highs and lows.
So it sounds like it's going to be really, really spicy. So we'll have to stay tuned for that. So in January. Yes. Now, Dr. Contessa, it's been such an amazing time chatting with you. We got to know, where can people follow you, keep up with what you're doing? Tell us what you got going on. And how can we here in the exam room best support you?
Well, a couple of things. One, of course, Chastain Integrative Medicine is my husband and mine's new practice. So we're super excited about that. So if you can't come see us in person, we do virtual appointments, and just, of course, keep us in your prayers. You can find me on social media, Instagram, Dr. Contessa, Twitter, ATL Contessa MD, and I'm doing a YouTube channel, of course, like everybody else. So we got a new YouTube channel coming to give you another glimpse into our family. And I have a couple of books coming out, a little bit of everything, a line of vitamins and healthy supplements. So it's just so many things in the horizon. So again, just keep us in your prayers.
Thank you. We definitely will. And look, I told y'all there wasn't nothing she could do. She fly planes too, and all this other stuff. So she is definitely a woman. Got to do it. So Dr. Contessa, thank you so much for your time. Don't be a stranger. We're going to consider you a consulting physician here in the exam room, and would love to have you back to talk about those projects as they, get set to release, so we can tell our people more about them, because we want to support you. So thank you so much for your time. We really appreciate you.
And happy Thanksgiving, everybody. Be safe, but have fun.
Thank you,
Dr.
Contessa.
Virtually. Yeah.
Yes.